Hey everybody, happy Friday. We're doing another doctor series and we have actually Dr. Ashley Lee on today, and she is from Northern Illinois Foot and Ankle Specialist in Illinois. Hi Dr. Ashley, how are you?
Hi, I'm well. How are you?
Good, good. Thanks so much for coming on today.
Yeah, of course. Thanks for having me.
So I know we're going to kind of get into the nitty gritty, which I have so many different questions to ask you about National Diabetes Month, which is November, and a little bit about your fitness routine, because I know you as a doctor love to stay fit, and all of us could use some tips at home, especially during this pandemic where they're starting to shut down some fitness facilities again. So I do have some questions about that, but I wanted to just start with the basics today. Can you share with us a bit more about your background and why you chose to become a doctor?
So I'm originally from Texas. I went to undergrad in Oklahoma. I knew from a pretty young age I wanted to be in the medical field. I explored in undergrad various medical specialties, and I really found podiatry to be a really good fit for what I was looking for. Lots of variety. The big one is I'm not only a clinician, but I'm a surgeon. And I'm a little bit of a dermatologist, a little bit of a plastic surgeon, a little bit of a sports medicine doctor. So I love that I could see it all. So it was an easy and perfect fit for me.
Absolutely. And I know that obviously during this time, you guys have pretty much been open and treating patients. So what is your day-to-day? Describe what you've really been up to during this time. Are you still doing surgeries and things of that nature?
Yes, we were back in the spring. We were shut down, as most everywhere in Illinois, for elective surgery. So we were really just doing, and they had pretty strict guidelines for urgent and emergent surgery. That was pretty short-lived. So starting kind of mid-May, our patients, I feel like I'm seeing more. People are working out more. They have more time to do it. They're doing things that they normally haven't done before, maybe exploring exercises outside or inside. And so I'm seeing a lot more pathology during COVID because people, thank goodness, are uh, doing more, staying active. So it really now we're taking a step back as a state a little bit, but so far, we're still doing all of our surgeries and seeing our patients very safely in the office.
And I know that you're a kind of a huge fitness buff. So tell us a little bit more about how you personally, as a doctor and just, a regular person, is staying fit and healthy during this time.
Well, I have found it's actually been easier because so many things are streamed online. You can do exercise classes that I may not have been able to make before because I have to be in surgery at 7 a.m. But now I could get up at 4 o'clock, 4 a.m. and do a class, pre-recorded class. So I have found personally, I've been able to sort of just focus various times throughout the day that I normally wouldn't, instead of doing live classes, going more to the online platform. Also, being mindful, like you just have to be aware. You hear about the COVID-15, just being mindful of if you're home more, not eating or snacking. That's the big thing. If you are home more, we tend to snack a little bit more versus in the office. So I've just, like I said, I've just stayed active for my body and my mind. It's a good deterrent to have exercise during this time.
Yes, definitely. And what about somebody who's like just trying to get started and maybe, do a few little things here and there at home? What's your suggestions for them, like for just a beginner who just wants to kind of move? Maybe they have a stationary job where they're at their desk all day at home. What are some advice for those type of people?
Well, again, the online platform has, is free for many platforms are free. YouTube videos, they have all sorts of exercises for, new to working out, for beginners. There's a lot of beginner exercises out there. If you're at your home office, you're sitting at the desk, setting reminders to get up, maybe do a quick 10-minute workout video, or weather permitting, go for a walk. At the office, you typically probably wouldn't have access so easily to your gym shoes. But at home, take your lunch break. Instead of taking the whole time, just have a quick salad or something for lunch and go for a walk.
Absolutely. I love that advice. And I know November is National Diabetes Awareness Month, and my mom's actually diabetic. So I definitely feel like this is really important to kind of give people some advice and knowledge regarding that. She actually found out she was diabetic through her feet because they kept swelling up, and she was very upset that she couldn't fit in her heels anymore. So it's basically the only reason she went to the doctor. But why do our feet tell us, we have some issues going on in our body? And do you have any advice for anybody who, is diabetic and, is here during the pandemic? What can they do to help their diabetes?
Well, the first part of your question in regards to, I think it was diabetes in your feet. Some of the first signs that we see and patients will come in is sensation. Sometimes it's swelling like your mother, but it's that loss of sensation or my feet feel numb. And sometimes they don't even notice that. They come in, maybe they notice something on their foot and all of a sudden we realize, hey, you have a really bad callus and underneath there you have an ulcer. And people are really surprised. Why didn't I feel that? And they didn't realize they had lost that sensation. So immediately when we have those patients that haven't been diagnosed but have that loss of sensation, we get them tested, work with their PCP, check on their glucose and their A1C level. So those are the first signs that I generally see in our profession. And again, the swelling can be one as well. In regards to, how a diabetic can handle this time, I think that's what you asked, right?
Yes.
During this time, the same thing I would say for everybody. I mean, with diabetics, you have to really be mindful of your diet, really trying to limit carbs. And even some people are thinking, well, I eat fruit all day or bananas and all of that. That, especially when you're a diabetic, in moderation, too much of good carbs when you're a diabetic is not a good thing. And keeping hydrated, especially now with wearing masks, people aren't, it's not as easy to take a drink of our water. So that's important to keep hydrated. And then, if you do have more time during the day, if you're working from home and you're diabetic, being mindful, checking your blood sugar, see what causes blood sugar spikes. And then stress, stress is a big thing on all of us, and it could cause an increase in our glucose levels. So finding ways like exercise, just like a non-diabetic, but exercise is very important to help manage your diabetes as well.
And kind of like the flip side of that question is, what can happen if you're not managing your diabetes? I'm sure you have seen a lot within your career. What is, let's say like the worst scenario that could happen and why this is so important?
Well, worst case scenario, I'm sure everyone's aware, is losing a limb. So we work very closely with our diabetics and their specialists, whether it's their PCP or their endocrinologists, to really try to prevent that worst case scenario. We see, unfortunately, with diabetics, as sugar increases, your risk for everything increases, on all of your body, your eyes, your kidney. We see as that risk increases, it also affects your arteries. And the first spot that we notice the diabetes narrowing the arteries is in your feet. So you can start losing blood flow. People have heard of gangrene. It's literally when tissue dies and it turns black because it's not getting enough blood flow. And having out of control blood sugars definitely contributes to that. And again, with the effect on nerves, so you don't feel, those of us who do feel say, how can someone let something get that bad to the point where they have an infection that causes, a loss of a body part? But people don't feel it. They don't feel it. So it goes, they don't notice it. And sometimes the infection starts forming under the skin. So they're not bleeding. They don't notice anything in their socks until, unfortunately, it's too late. We also see a variety of bone deformities that can happen with diabetes, something called Charcot foot, where we're not 100% sure what triggers that, but it's always in the neuropathic patient, so someone who can't feel. And sometimes it's just a really minor event, maybe even nothing they remember, stepping off a curb funny, but, obviously has no pain, but the nervous system sort of gets overly excited and the bones start to slowly destroy. So it turns into like a bowl of mashed potatoes and it really deforms your feet. It obliterates joints. And so you're left with this very, very deformed, difficult to walk on foot that can lead to ulcers, which can get infected and lead to losing a limb. So we see all of those complications associated with diabetes, and infections, as we know, can get into the blood and unfortunately cause death. So we like to obviously prevent that and work closely with our patients and their team of doctors to monitor for any of those potential risks and prevent them before they occur.
Absolutely. Yeah, that's really, really important and good information. The other question that I wanted to ask you is, I know that we're heading into New Year. I'm sure many people are excited about that.
Yes.
And I know that you're a surgeon. So every year, obviously, there's so many different advancements in medicine. Has there been any new medical trends that you've seen in some of the surgeries that you're going to be doing in 2021?
Well, the exciting part of that, and it's used in the clinical setting and surgical setting, is regenerative medicine. And our team really tries to be innovative and find the latest in regenerative medicine. And what that is it's ways to try to get the body to heal itself. So yes, we as surgeons can fix something, but is there a way that we can do a part in helping your body trying to heal that? So for example, platelet-rich plasma, so PRP injections, is something I like to use in surgery. You can also use it in an office setting. What that is we actually take the patient's own blood, we spin it down, and we get the rich plasma, which is that brings all the good cells, the healing cells. And so in surgery, if I'm working with something that isn't very vascular. So think of your, high school anatomy books. So things that are white, like tendons and ligaments, those don't get a lot of blood flow. So it's harder for those sometimes to heal. So using that in conjunction with the repair of a tendon can be helpful. There are so many, stem cell type injections, amniotic type of injections and grafts that we can use to, again, help the body repair itself after we do our part. So regenerative medicine is exciting, and it will continue to grow. This is the kind of the way that medicine's going.
Absolutely. And did you have anything else that you wanted to add, or any more advice for anything for National Diabetes Awareness Month, or where we can find more information about you and come see you?
Sure. In regards to being a diabetic, just staying fit, trying to stay positive during this time. Unfortunately, we see, people getting depressed during this time, eating more, gaining weight, which can lead to diabetes, or can sort of spiral their already existing diabetes into kind of a bad cycle. So trying to stay positive, try to eat healthy. If something doesn't feel right, sometimes the first sign of just being diabetic is something doesn't feel right. And it's a very easy blood test. If you have any of those, common symptoms that we hear about, being thirsty, urinating frequently, again, loss of sensation in your feet or your hands, feeling very tired, sometimes weight loss, sometimes feeling very hungry and just can't, quench that thirst. So any of those signs, don't be afraid during these times to get a hold of your primary care physician or podiatrist or endocrinologist. Telehealth is there. We can, I see patients via telehealth as well. But any more questions, you can certainly visit us on our website at www.illinoisfoot.com, and we're happy to answer any of your questions.
Thank you so much for coming on the show today, Dr. Lee, and we hope that you have a great holiday, and we appreciate all your advice today.
Thank you. Thanks for having me.